Welcome to the webinar on evaluating Africa's COVID-19 responses, managing risks and setting priorities. Good morning to you if you're in Africa, or good afternoon if you're in Asia. I'm Casey Kwok, Director of the AsiaGlobal Fellows Program at the AsiaGlobal Institute of the University of Hong Kong. This webinar is an initiative of the AsiaGlobal Institute to bring together our AsiaGlobal Fellows from around the world to have a dialogue on important global policy issues. All the panel speakers today, including our moderator, are our fellows from Africa. The coronavirus pandemic is still ravaging the world. The number of daily new cases is still on a rising trend, setting new highs from time to time for the world as a whole. In Africa, apart from certain countries such as South Africa, the per capita infection rates for most of the countries are relatively low. However, the health, economic, and social challenges are significant because of the continent's relatively less developed economies and infrastructure. With this very brief introduction, let me pass the floor to Kadidia Konare, one of our 2020-21 fellows from Mali, to introduce our panel speakers and to kickstart the discussions. Over to you, Kadidia.
Thank you, Casey. Thank you for the nice introduction and the general overview. Hello, everyone. Welcome to this discussion part of the webinar. My name is Kadidia Konare, and I'm pleased to be moderating this session today. Just a quick disclaimer, I'm speaking in my personal capacity here and not as a representative of the World Bank Group. I'm grateful to have a distinguished panel of AsiaGlobal Fellows from Africa, more specifically South Africa, Nigeria, and Zimbabwe. They will be sharing their insight on the current COVID-19 situation on the continent, and they will also tell us how African governments have been responding to the crisis, managing risks, and setting up priorities. The agenda is as follows. I will start by introducing our panel members, and then we will go into some opening remarks and a moderated Q&A session that will last about 20 to 25 minutes. And then we will have the opportunity to have a Q&A session with the audience. Please note that you can submit your questions at any time via the chat box in Zoom or on the Facebook page of the Asia Global Institute, or you can send your questions by email as well. On the panel today, I'm pleased to welcome George Lwanda. George is a 2018 AsiaGlobal Fellow from South Africa. He is currently a senior strategist and head of the United Nations Resident Coordinator's Office in the Gambia. We also have Charity Amayaenvbo, who's a 2019 AsiaGlobal Fellow from Nigeria. He's currently the Executive Director for the Income Tax Edo State Internal Revenue Service in Nigeria. And last but not least, Clayton Vhumbunu, 2021 AsiaGlobal Fellow from Zimbabwe, and currently a technical officer at the Rhodes University based in South Africa. Please note that all the panelists here today are also participating in their personal capacities and not representing their employers or anyone else. A very warm welcome to you, dear co-fellows. Like Casey has really already put the big picture on what's happening globally with the COVID-19 pandemic. We know that it's not only the most serious global crisis since the 1918 Great Spanish Flu, but it's on the path to become one of the most economically costly pandemics in recent history. According to the World Health Organization statistics, we have about 15 million confirmed cases globally and more than 600,000 deaths. In Africa, you have 47 of the 54 countries in Africa have been affected by the COVID. Although the numbers seem very low in Africa, as of today, we have about a little above 600,000 cases and deaths a little below 10,000. So you can say that Africa numbers are not as high as in hotspots like in the US, Western Europe, Asia, Latin America. However, the pandemic is gaining momentum on the continent. According to the Africa CDC, the rate of contamination is going up in number of African countries. And COVID-19 is expected not just to bring a health crisis, but an economic one. You will see that the social economic impact is already bad in the continent as actually and is taking place as we speak today. We hope that this webinar will help us understand the issues and learn about some of the policy responses being adopted by African countries. So without any further ado, let's get started. I would like to start by asking each of the panelists to briefly introduce themselves and make their opening remarks. I propose that we go in the following order. Please, let's start by Charity, then Clayton, and then we'll end with George. Please, Charity, the floor is yours. Thank you.
Good morning, Kadidia, and thank you for having me. My name is Charity Amayaenvbo, and I'm the 2019 AsiaGlobal Fellow. I currently speak to you today from Benin City, Edo State, Nigeria. And as you have rightly stated, I would want to look at the coronavirus as it affects Nigeria, West Africa, and maybe possibly, if there's time permits, Africa. Nigeria is the most populous country in Africa, with a population of over 200 people. And as Casey has given in his introductory remark, and you also, the coronavirus has come to become a pandemic that has hit nations and the continents in its worst states. And in Nigeria, the situation is not different. Our own first index case was recorded in February 27, 2020, and it was an Italian citizen that was visiting Nigeria for business purpose. He arrived in Lagos, which is now become the epicenter of the pandemic. And after some few days of his transactions, he fell sick and was tested positive for coronavirus. So he became the first index case in Nigeria. 10 days thereafter, which is specifically 9th of March, a Nigerian citizen who had had contact with this Italian national that was visiting Nigeria also contracted the coronavirus and became the second case of Nigeria in Nigeria, and became the first Nigerian to contract the coronavirus in the country. Since that period till I speak, the virus has spread and has entered the community stage, in which the 36 states that make up Nigeria has had confirmed cases of the coronavirus. I want to go into a little bit of statistics just to highlight the situation in Nigeria. And like Kadidia has said, I would want us to believe that the statistics might look low, but as I go into the discussion, I will tell you that the statistics might not really give a fair view of the race situation in Nigeria. Currently, we have a total confirmed cases of about 38,000 in Nigeria. Out of these confirmed cases, about 16,000 has recovered fully from the pandemic. And we recorded, unfortunately, above 800 deaths. The total number of tests that has been carried out, sample tests, is barely between 220,000, and that reflects the numbers we are having. As I go ahead in my discussion, because Nigeria is a population of 200 million people, and we barely had 1% of tests. And what it means is that a lot of people are out there on the streets testing, who would have tested positive to this virus, but because they've not had the opportunity of being tested, they carry it on and we just live with it. And that also is why I said the figures might not truly reflect the state of the pandemic. And maybe also because we having an asystematic situation whereby a lot of people who have it and yet they don't display symptoms. They might just have the mild or moderate symptoms of the virus. Going further into the statistics, Lagos State, which is one of the economic names, though not the capital city in Nigeria, has over 36% of confirmed cases of coronavirus in Nigeria. This is understandable because that is where is the economic hub of the country, and that is where most of the activities are. And when you look at Lagos and two other states like the FCT, which is the Federal Capital Territory, Abuja, and Oyo State, the three states account for 54% of the total confirmed cases of coronavirus and 29% of deaths in the whole of death fatality in the whole country. So these three states are where you have major, and there are some states where you just have some bare few numbers, less than 10, 20 coronavirus. And we are still at the early stage of this virus. Going into West Africa, which is just the sub-region, Gambia has the lowest number of confirmed cases. We just have barely 112 cases in Gambia, while Ghana, Senegal, Sierra Leone, Togo has the highest level of recovered rates, about 80% recovery in these countries. And we'll look at what they are doing right that is making people recover quickly from the virus, while Nigeria still remains the highest case facility rate in West Africa. So when you look at the presence of the virus in Nigeria and West Africa in the last 3, 4, 5, 6 months, one would want to say what has been the policy response of governments in these countries, in Nigeria and maybe West African country. And looking back at a World Health Organization evaluation, joint external evaluation report in 2017, they've actually had an evaluation of Nigeria's response in terms of pandemic like this. And I will tell you, it wasn't a good report. Nigeria was scored low in terms of response, in terms of preventions, in medical, and maybe some of this kind of pandemic, because we had Ebola, and the way the government responded to Ebola was a little bit slow before we could actually tackle Ebola. But looking at this response so far, the testing ability has been very, very poor. There has been shortage of testing kits. Even the medical personnel are in short demand. They are poorly remunerated, and a lot of people do not want to even be in the front line in trying to tackle this epidemic. And that has sort of reduced our performance in trying to curb the spread. We have not even gotten to the peak yet. On a daily basis now, we record over 600, 700 cases on a daily basis. And we're still hoping that we have not gotten to the worst situation yet. Even the best space right now is limited in number. The number of ICT care is less than barely 500. And most of the confirmed cases are being referred back home for home management. And that is really where we are having a serious crisis in our hands. But like I did say, the government were slow in terms of response. It took almost about 1 month before the presidential task force was put in place. And after the presidential task force was put in place, they tried to bring in some economic, social, and health response to try and curb the spread of this virus. And in this response, let me talk about the economic response aspect of it. They tried to enact a stimulus response bill through the National Assembly. And in that stimulus response bill, there was a 50% tax rebate businesses because of the lockdown, a lot of businesses were affected, and they try as much as possible to give them this rebate to stimulate savings in order for them to keep their workforces. But looking at Nigeria, that was just a far cry policy in the sense that 60% of our GDP are done in the informal sector, and that informal sector employ 90% of the workforce. So when you are giving rebate to businesses that are formal and leaving the informal sector that controls 90% of the workforce, I feel it is still an area the government needs to do more, because it has not really transcended into trying to solve the situation of stimulating savings or trying to help the businesses to retain their workforce, because right now there are massive loss of jobs in the country. Also, the government tried to do cash transfer to the poor and the most vulnerable among the society, knowing so well that the people are going to be indoors, trying not to have too much community, reducing the community spread. And they peg it at $52 per individual. And looking at our poor data system and information system, electronic payments, this cash transfer is also problematic. It is marked with a lot of corruptions and all that. A lot of people are not able to access this cash. And even the social register that they try to tie it to, only 11 million Nigerians are registered under that scheme out of a population of 200 million. So it was a far cry from trying to meet up with cash transfer to poor Nigerians or vulnerable Nigerians. Also, the Central Bank of Nigeria also tried to have its own stimulus policy also by trying to give out loan facilities to traders or business owners. But it has also its own caveats in the sense that you must have collateral, and it was not an interest-free loan. And for me, that has really not solved the situation, because people do not have collateral to access this loan. And when you say they are not interest-free, this pandemic is not going to allow people to do normal businesses. And when they are going to pay huge percentage on loans, people are still not going to benefit from it. Also, the government decided to try to come up with food palliatives, giving out foods to the vulnerable, opening food banks across the country where people can go and access food. And like I said also, it was all marked with corruptions. In terms of social response, first of all, the government introduced total lockdown. They were banned on interstate movement in order to curb community spread and interstate spread of the disease. People tried initially to pin this virus to the 3 epic states, but with the ban on interstate movement, it still did not curb the spread of the disease. Also, there were closures of schools. Almost as we speak now, all public and private schools in Nigeria remain closed. Initially there was a nationwide curfew from 10 p.m. to 6 p.m., which is still in place. And the interstate movement was just lifted from the 1st of July this month. Also, we had banned on international flights, and they were also banned in local flights. Local flights just resumed because the government has actually started some partial easing up of the economy after the huge pains that people are in. So, given what we had so far, I think the policy response of government is not enough. More needs to be done. And as we go along in the discussion, I'll share more light.
Thank you very much, Charity, for this very long overview. So let's now hear from Clayton and his view. Thank you, Clayton.
Thank you, Kadidia, and good morning or good afternoon or good evening, depending on where you are, those who have joined us on this webinar. As introduced, I'm Clayton Vhumbunu. I'm a technical officer at Rhodes University here in Grahamstown, South Africa. Basically, my contribution, I'll be focusing on South Africa and also make references to Zimbabwe and also Ethiopia and Egypt in terms of the impact of COVID, their experiences, and what we can learn from the process. I think one of the countries that I'm covering here in my presentation, Egypt, was the first one to record a COVID case on the continent, having recorded a case in February on the 14th. Then we also recorded a case in South Africa on the 5th of March. Then, of course, in Zimbabwe recorded their first case on the 20th of March and Ethiopia on the 13th of March. Most countries in Africa, that's when they recorded their first cases there. But what can be noted and what seems to puzzle almost everyone now is that there's been a rapid increase in terms of the number of cases that have been recorded since then in South Africa than in any other country on the continent. As we speak, since the dates that I've just mentioned, when the first cases were recorded in South Africa, Ethiopia, Zimbabwe, and Egypt, we have seen that as of today, there were over 300,000 positive cases in South Africa. Precisely, we had 381,98 positive cases in South Africa. But the deaths, they seem, of course, low when compared with the other countries which have experienced the high positive cases across the world. Zimbabwe itself had, as of yesterday, 1,820 positive cases and 26 deaths. And Ethiopia had 11,072 cases and 180 deaths. While Egypt had 89,078 cases, while the deaths are at 4,399. So the trend has been a huge spike of positive cases in South Africa, while the deaths, of course, by comparative basis across the continent, they seem high. But if you compare, of course, with the other countries, it's low. We say this because South Africa, as we talk, is the fifth in terms of the highest number of positive cases in the world. Of course, behind the USA, Brazil, India, and Russia. But when we look at the deaths, they are still very low. We are going to discuss that. A number of measures were instituted, of course, here in South Africa and other countries like Zimbabwe, Ethiopia, Egypt, and the rest of the African countries. Like what my colleague indicated, of course, there is this institutional architecture that was, of course, the first response. Of course, this was an emergent case, and it appears no African country thought that we would be hit by COVID as we are now. So the first institutions that were put in place, most of the time we find they were command centers or task forces that were put in place. Here in South Africa, there was the NCCC, the National Coronavirus Command Center that was put in place, of course, to assist in terms of decision-making and also advising on decisions and policies relating to the prevention, control, and management of COVID-19. The same applied also. Zimbabwe had to put in place its 24-hour COVID command center and national COVID task force. There was some form of institutional architecture that was put in place in all the countries, Ethiopia, Egypt, and of course, these were working with the ministries responsible for health, and also those ministries responsible for information for the purposes of communication, of course. Then the restrictions that were put in place, again, it appears African countries were learning from each other and also learning from the best practices, of course, in light of the guidelines that were coming from the World Health Organization. So you find that the interventions that were implemented or effected in the countries basically related to issues to do with the restriction of movement of people and also economic activity. Then also there were interventions that were mainly targeted at fiscal and monetary issues. These are fiscal and monetary measures. And also we had interventions that were basically targeted at the vulnerable population of the society. Of course, we are talking of those that are not employed or that were unemployed because of the circumstances, the disabled, the youth, and of course, those who are socially distressed by different circumstances. For South Africa, for example, you find that there was the announcement of the national lockdown at the end of March. And it came with a lot of restrictions of movement of people, banning church activities, even travel bans, they were affected. And also, that's when we started to see the rollout of national testing programs and isolation. And of course, it was accompanied by the construction of quarantine and isolation centers. The same applies also to the other countries that I've just mentioned. Of course, the degree was different in terms of the strictness or tightness of the lockdown measures. We find that Zimbabwe had to follow suit, also announcing their own lockdown measures. But you find that there are countries like Ethiopia, for example, of course, they declared a state of emergencies, but you would see that there will be a lot of movement. of people on the streets and carrying out their informal activities. That's where we saw a spike, of course, of cases in almost all the countries that were failing to effect or to enforce their lockdown measures. But it went on when the lockdown proceeded. You find countries, they started to gradually relax and phase out lockdown measures. Of course, there was economic pressure from the economic side of politics. As a businessman, of course, wanted to get back to business, while it's also the general or ordinary citizens, they also wanted to get back to work because of the economic stress that was being affected by these lockdowns. So in South Africa, for instance, we saw the easing of the lockdown on the 1st of May. And of course, later in July this month, we saw the reintroduction, of course, of the same restrictions, but of course with minor adjustments because of the spike in terms of the numbers of positive cases. So countries, after initiating lockdowns, there were economic pressures from citizens, also from businessmen. Then of course they had to review the lockdown measures. But of course governments, they've insisted that their revision or adjustments are based on research or evidence on how the COVID graph was going and also how it was affecting the economy. In terms of economic, fiscal, and monetary interventions, the countries above board, of course, they had stimulus packages that they introduced in order to ease the economic impact of COVID or the social impact of COVID on the society. In South Africa, here, 500 billion rands was a stimulus package was availed by government. And of course, it was divided into various sectors. And they also introduced, of course, an employment insurance fund and special programs from the Industrial Development Corporation for companies and workers that are in distress. Even from the SARS, the South African Revenue Services, there were a lot of initiatives that were introduced to ensure that at least the general citizens are protected from the impacts of COVID. For instance, the South African Revenue Services, they accelerated the reimbursements of tax credits, allowing the small and medium enterprises to defer certain tax liabilities. There were also issues relating to SARS, also relating to the other issues on essential goods that were given rebates, and also the Department of Trade and Industry also putting in place control measures. This was also seen in different countries also. Like if you check also the experience in Zimbabwe, where they had their own COVID-19 response plan. So there were different interventions that were made in terms of fiscal and monetary measures. But of course, we have to mention the targets that were made, also including the vulnerable of the society, the SMEs, and also the socially distressed. I will address some of the issues when it comes to the Q&A questions because of time constraints. But perhaps I need to close by saying that the experiences in the different countries perhaps have exposed how the healthcare systems have been like in the different countries, and also the extent of informality of the economy, which when brought to a halt, it affects those who are vulnerable and employed in the formal sector. And also we have to mention lastly that the issue to do with policy-based interventions that are based on evidence is something that is a bit lacking in most of the countries, that interventions at times they are knee-jerk and not informed by research and science. Thank you for this.
Thank you very much, Clayton. Now, George, yeah. So George, I will ask you to be a little bit brief because then we'll have only 10 more minutes before we open up to the audience.
I will be very brief, coming last. I think I will just talk about especially the managing risks and setting priorities part. And since my colleagues have really gone into detail about what's happening, permit me to use the Human Development Index reasoning to reflect on the long-term effects of COVID on human development on the continent. So if we look at the Human Development Index, it's generally accepted as a summary measure for assessing long-term progress in 3 basic dimensions of human development. The first is a long and healthy life, which is measured by life expectancy. And in this regard, if you look at the last 20 years, Africa registered the biggest gain in life expectancy worldwide, with life expectancy increasing by about 11 years. In addition to that, the cohorts that were living up to the age of 65 increased. One measure which also shows that and also shows some gains made in gender equality, for example, include that whilst in the year 2000, only 46% of females in their cohorts would get to the age of 65, by 2018, about 63% were getting up to the age of 65. This took 20 years to build up these gains, but basically what we're seeing here is these gains which took 20 years being threatened to be wiped out in about 270 days. And it will have dire effect on Africa, on the human development of Africans, especially if you take, for example, the fact that it is depleting the skills base that Africa definitely really needs right now. Gambia is a country with the lowest caseloads in West Africa, for example, but 40% of these infected are health workers. And if you start losing those, then you're also losing how you can control it. The second component of the Human Development Index, if I could move to it, is access to knowledge, which is measured by schooling. And we've seen school closures. And in countries like Kenya, the school year has just been written off because governments genuinely could not handle the situation. But it does have many effects on both children and parents, proven by scientists, but also it has affected a lot of kids a lot of kids do depend on school feeding programs for their nutrition, and things like those have really been affected. The third measure of the Human Development Index is decent living, which is measured by the gross national income. And if you look at the COVID effect on this, there's been a great loss of employment, loss of livelihoods, which my two colleagues have alluded to. And all of this has also come in cahoots and led to greater social ills, which we've seen, and the most immediate of which worldwide has been an increase in gender-based violence. And for me, I'll think that if Africa is to sit down and look at how to manage the risks and set the priorities beyond COVID from a human development perspective, those are the areas and probably the issues which they'll have to look at. Thank you.
Thank you very much, George. So what I'm hearing is the situation is bad. The socio-economic impact on the continent is bad and is not getting better. We have poor testing, inadequate health facilities, and definitely lack of health workers. And also the stimulus packages so far have been limited and not really going to some of the most vulnerable people, the poor in those societies. So maybe I can ask my co-fellow charity to tell me, have we seen the worst yet in Africa? Because many people have predicted doom days for Africa. Have we seen it, or are we going towards that? Please, if you can help me elaborate on that.
Thank you, Kadidia. And I would not really want to sound as a prophet of doom, but the reality is that we are still heading for the worst in Africa. We have not gotten to the peak yet, and I can tell you why. The fact that we are seeing these low figures now is just simply because they are not doing a lot of testing. the testing in most of these countries are still very, very minimal. And the more we try to increase the testing capability of countries, we are going to see more numbers as confirmed cases. And for example, like I said initially, in Nigeria, we just have barely 3,000 tests in a day. And when the pandemic started in February, there were just barely 4 testing centers in Nigeria, though that has increased to about 72 now. It's still a far cry from the numbers of people. And even right now, it takes 6-5 days for test results to come out, and people are not too comfortable with that. People have to resort to private and pay to have testing being done. And that is why you see some of these figures and we feel it's okay. It's not really okay. Also, because some of the symptoms of this coronavirus are symptoms that we in Africa has lived with before, symptoms like malaria, pains, and all those things. So people, even when they have it, they still feel it's malaria and they don't want to go further to do tests on COVID. And except when the pandemic, when they start feeling very much severe symptoms, that is when they make themselves available to the NCDC for tests and all that. So I believe we have not seen the worst yet. The worst is still going to come, unfortunately. But I think it's a wake-up call for our government to try and do more. Currently now, the bed facilities, the hospital facilities, the ICU facilities are inadequate. People resort to self-help to get themselves treated and all that. And so when the situations has its full impact in Africa, we are going to be seeing a lot of hunger, a lot of starvation, and the economic consequences is going to be huge.
Thank you. So let's now think of, we see different responses across Africa. They're not uniform. It looks like we don't have a one policy fit all. It's countries are doing, responding based on their capacity, their financial, economic capacities. So let me ask my colleague, George, to tell me what in the responses so far from African countries that have encouraged him. George, so the question is for you. Are you encouraged by what you are seeing so far?
Well, we need to be encouraged. It's the only way we can get through this. There are some discouraging things, but I think that, well, in the 2 minutes that I have to answer, it's hard to tackle it all. But I must say that for me, there is at least 2 issues which really have encouraged me. The first is that the response we've seen has reassured me of the need to accelerate on regional integration. The importance of the African CDC has been only emphasized by the amount of logistics and receipt of, for example, the receipt and delivery of the 4 rounds of donations from the Jack Ma Foundation, or was it 3 rounds, to almost every African country. And the logistics around that had to be done and done quickly. And the information that has come out from the African CDC as continental level information and guidance has also been very encouraging, which leads me to the second thing, which is about sort of like partnerships, you know. That leadership has sort of, if I were to say, it has confirmed the relevance of multilateralism at a time when multilateralism is under attack. So you've seen countries, we've seen China or Chinese foundations such as the Jack Ma come and assist, working with the African Union through its CDC. We've seen and the United States also work with countries through continental institutions. Most of all, we've also seen the United Nations come together. And I dare say that despite the attack which multilateralism is under, if you look at African countries that have collaborated with the WHO you would find that they seem to have this under better control than those that haven't. So those are the two issues that stand out for me. Thank you.
Okay, thank you. I see some questions from the audience. Let's try to take some of those. A question from Thailand is that, so the question is, could you provide information on what, if any, are regional collaborations on policies to curb the COVID-19? So I guess this is for anybody on the panel.
Well, what comes to mind for me is in the immediacy of the virus. We saw quite what I would call quite well coordinated in terms of how borders were closed. I'm not saying it wasn't without its own problems, but there were at least interstate agreements. The way at least Gambia and Senegal, for example, went about closing their borders. Not that they didn't have their own inconveniences and their problems, but I think that it really helped the continent to stop the entry of the virus. And that has somehow bought the continent a lot of time. Thank you.
Okay. So another question is, so I think you've already touched on a little bit on this, George. It's about the China's effort to provide assistance to Africa during the pandemic. How has this face mask diplomacy been received? How have China's relationship with African countries been affected, given that the coronavirus originated in China? So,
Okay.
Oh, sorry. Yeah. No, go ahead, Chad.
Okay, Kadidia, if I want to take that, I will tell you that China and Nigeria has maintained a very cordial relationship before this pandemic, and I can tell you, with the coronavirus starting from China, has not really helped China in Nigeria. And I can tell you, even when we're going to have Chinese doctors visiting Nigeria, it was an uproar in government saying, oh, what are the Chinese doctors coming to do in Nigeria? I hope they are not coming with more coronavirus to infect Nigerians. And the government at a point has to even do a disclaimer that they were coming purely at the invitation of a Chinese company to take care of their national. So I can tell you, though that stigma is there that, oh, this thing came from China, it has still not affected our relationship. They've collaborated through supplies of medicals, like face masks and testing kits and all that. And we still see them as a big continent to rely on in Nigeria and also in Africa. So though those initial stigma was there that, oh, China this and this thing, the government and also the people are beginning to see that, oh, China still remains our big brother and will continue to maintain that cordial relationship with China.
Okay. Thank you very much.
Can I add something?
Yeah, please,
just
go ahead.
I know there's some diplomacy and whatever that is involved in this, but I think at the end of the day, maybe I'd rather focus on the good things that came out of this, because once you start adding, like Charity has shown there, that its good relations stayed well. But once you start adding face mask diplomacy, that diplomacy, you start politicizing COVID. And unfortunately, in Africa, that doesn't help in a situation where sometimes people feel like, oh, this came from China, and it did come from China. But you had a situation where by that time it had spread to Europe, for example. You had a situation at an airport where all the people, all Chinese or Asians, were told to stand aside and were being tested for temperatures, whereas all the Europeans were being let through. And so it can lead to misunderstandings that are not helpful in Africa's handling of the crisis. Thank you.
Thank you. So I have another question from the audience is, to what extent should sub-Saharan African countries draw on the learnings from the pandemic response of countries around the world? or look to establish its own model given its racial, health, and socio-economic particularities?
Yes, Kadidia.
Mm-hmm.
I think I may take that, and perhaps colleagues can add. Indeed, there are a lot of lessons that we can learn, that can be learned from the different country experiences that we've had, not just from our African peers, but also from abroad in Asia, Europe, and even America. Perhaps what we need in trying to learn this is to also understand our peculiarities. In Africa, for example, I think it's a question that has been asked by one of our audience, is that what interventions have been made. I think there are learning platforms that we already have. Like, for instance, the Africa Center for Disease Control, the Africa CDC, which is hosted, of course, by the African Union. They have centers across the region. They came up with a strategy, the COVID strategy, which all African countries are taking a guide from in terms of the prevention, management, and control. And also the African countries, they are also having their own learning platforms at regional level. Already SADC, the Southern African Development Community, they have their guidelines on how they can maintain trade between and among themselves as the COVID insists and persists. We know most borders have been closed here in Southern Africa, but they have agreed to open the corridors, the borders, for the transport of medical supplies and also food supplies and other critical supplies that are very important for COVID. The COMESA also has done the same, the Common Market for Eastern and Southern Africa. They have come up with guidelines also on how their member states can also share their experiences and also guide themselves as they trade with each other and exchange. But this is very important to allow a coordinated approach. And we didn't see this when COVID started. For instance, we would have a flight that would come from Addis Ababa and fly to Ghana. Upon landing, they are told to go back and only drop maybe a few passengers who are residents or citizens there. There was sort of uncoordinated approach when COVID struck. Perhaps it was a sign of unpreparedness. But now we see a lot of cooperation and coordination, which we pray it continues so that at least we can be able to really fight against COVID and also, of course, lessen the impact. Colleagues may add from this. Thanks.
Yes, I would like to just come in and add what Clayton said, if you could have. For me, the overall thing, and it again talks to the managing risks and setting priorities, is one of the reasons I feel the certain responses were uncoordinated and we had to rely on learning from others is there's an overall message here in Africa is to invest in research, and investing in research in turn means investing in education, and investing in education in turn means investing in early childhood development and in health. And once you invest in those, you have a good system of data, scientific data you can rely on for going forward and what to do, be it in trade and everything else. And so for me, that's an overall message to Africa. Thank you.
Okay. Thank you very much.
If I had to add to what George has just said, Kadidia.
Yeah, please. Mm-hmm.
One of the greatest lessons to us in Nigeria here has become a situation whereby we've learned that medical tourism that has been the hallmark of Nigerian leaders or elites in Nigeria has become something threatening during this coronavirus disease, in the sense that most of our leaders couldn't even travel to Europe anymore for medical facilities or travel to Western countries. So they now have to deal with the poor infrastructure, poor healthcare facilities in Nigeria. So it has further opened up their eyes to develop the health facilities in Nigeria. And that for us is a disguising blessing to the common Nigerians. So it's a huge lesson, and they now know that they have to invest in healthcare, invest in the facilities, invest in personnel, so that when this kind of pandemic comes up tomorrow, Nigeria is able to respond smoothly, and we are able to take care of our citizens instead of the medical tourism that used to be the hallmark in our system.
Okay, thank you. So at the beginning, the responses were slow. not uncoordinated, and with very limited financial and human capacity. And now we see more and more collaboration and cooperation between countries, regional efforts, and even at the continent level with the African Union. So what can African governments do more to, or differently, to reduce the immediate and longer term social and economic impact that they're not already doing? So the question is for any of you. Yes, please.
Okay. I think again that there's you would want to look at that from at least sort of like two angles. There's the immediate, and then there is the long term. And I think, at least for me, in the long term, one thing which will help Africa, I strongly believe, would be investing in technology, especially technology for starters, because it is one of the ways in which it can expand the economic capabilities of a country, creating jobs, and also in this new normal of contactless trading, help with to facilitate contactless trading. But if you would also look particularly what you can invest in would also be green technologies, because green technologies also come with the fact that they do lessen, for example, air pollution, which lessens your health burden on the fiscus and things like that. But in order to do that, you need a market. African economies are, unfortunately, by any standards, very small to be able to handle the investments required. So you would need to also accelerate the regional integration agenda. And there already is an instrument, the Africa Free Trading Agreement, which helps to do that. And if they do that, I think it would help. And whilst doing that, there is the gender aspect, which cannot be forgotten. I don't know whether it's by coincidence, but if you actually look at the gender inequality index and look at the African countries that and how they working with corona, handling the pandemic, you find countries like Rwanda and Mauritius, where the gender inequality is lower, are handling it much better than generally where the gender inequality index is higher. So I think those would be the broad stroke lessons I'll touch on. Thank you.
Yeah. Any Clayton, Charity, do you want to come in? And what else do you think African governments can do differently?
I think we just need to come up with more pragmatic stimulus policy, because the economic impacts, particularly the informal sector, is going to be huge. There are already a lot of job losses that might result to huge insecurity or security issues as we go the months roll by. So we need to sort of activate structures that will bring about honest, transparent policies that can bring in savings and or can return people back to work. And particularly these small businesses, see how we can cushion the effect upon which the lockdown or whether partial or full lockdown has brought on those businesses. So there needs to be more pragmatic. Leadership is going to be very key in the next couple of months in Africa for us to come out of this pandemic.
Okay, thank you. Clayton, anything from your side?
Okay, I can add in perhaps with what my colleagues have said. As we speak right now, we need to understand that lockdowns have assisted, us to think why to say, if we are closed from outside, how do we manage? Meaning to say Africa for now has to move to be self-sufficient to some extent, to say how do we produce goods for ourselves and services and sell between and amongst ourselves? If the markets outside are closed, how can we cushion ourselves as we go forward? And that's why I agree to what George and colleagues say, to say the African Continental Free Trade Area presents that opportunity to say, how can we come together and enhance intra-African trade, which is still low at less than 16%. How can we make it more enhanced so that at least we can be able to trade between and among ourselves. We saw when we started with COVID, most countries, they ran out of face masks, something that we can produce in Africa. And we were now taught to say, we can produce this by ourselves. This is what we need to do as we go forward, to say, let's be able to be self-sufficient as Africa. We have all the resources. Let's be able to produce even the pharmaceutical products. We rely for over 75% from overseas supplies. How can we produce these by ourselves? This is what African leaders perhaps need to think about. And perhaps lastly, I can say also, let's try to value add and develop what we have so that at least, again, we don't expose ourselves to external shocks. For instance, we saw what happened to most countries like Nigeria, Chad, Gabon, Equatorial Guinea that rely much on crude oil sales. They have very little refinery infrastructure. They still want to sell to markets, and all of a sudden, the oil price, it went down, and they have nothing that they can do. They can't process it by themselves. This is what we need to look at as Africa, to say, let's look inwards, of course, without disengaging. I think that's what I can say. Yeah.
Okay, thank you very much. I think we have 3 minutes. And there are many, many more questions coming in. Unfortunately, we might not be able to answer all of them. So quickly, I will ask any of you if you have a final thought. If anything, I've heard it again and again. It's about regional integration. It's about collaboration. Let's leverage on the free trade agreement that is out there among African countries. The responses have WHO countries that have relied on WHO are doing much better in terms of their responses to COVID. And we have rural-urban disparities between the responses. So so far, most of the responses have been geared towards urban areas and very little done in the rural part of the African countries. So I will ask you, if every one of you can give your last thought, but let's limit it to 1 minute each. Thank you very much.
I'm going to close with a positive note, and I can tell you the coronavirus will be defeated. In Nigeria, we defeated Ebola, and I don't see the coronavirus being an exception. What I will appeal for is that we need more international support. The IMF, the EU, the World Bank needs to come to the aid of Africa, needs to come to the aid of Nigeria in fighting this scourge. We will defeat it, and together we will see the end to this coronavirus. Thank you.
George?
Thank you. I would say that there's a striking irony about the virus in Africa, and probably one of the things that have helped save Africa from it spreading very quickly, and that's the poor state of infrastructure and not being greatly interlinked. And I think evidence that supports that will show in countries like South Africa, Egypt, which are more interlinked. It has spread much quicker. And I think that also shows the space which Africa has to actually develop its own capacity and build the markets it requires. Without the markets, you will not really get the capacity of what you want to do or boast of the research that you want to do homegrown. We saw the case of Madagascar. It won't happen. And that, I think, is what Africa needs, I think. Thank you.
Thank you. Clayton?
Okay, thank you. I think what I can say in closing up is that we look at it from the way that African countries have to learn now to say COVID has exposed the state of our healthcare systems. It has exposed who we depend on when it comes to investment, to tourism, to industry, to transport, to travel, and so forth. Meaning to say that it's time now for our leaders to focus on this, to say, how can we engage all the various partnerships to work on these weaknesses that are in us? How can we be able to produce with what we have and be able to live with it if we are in cases or in times of pandemics or disasters like this? this is an expose that perhaps African governments have to look together. For now, I know African governments, they are more preoccupied at national level to deal with COVID, that it will come a time when internally they have to look at themselves and take stock of where they are getting it wrong. Then also at continental level, do the same, and regional level, do the same. So then to say, how can we make a better Africa? And in line with the Agenda 2063, and also of course connected to the SDGs, it's time for Africa to say, how best can we build the Africa we want by looking at all these after the expose by COVID? Thank you.
Thank you, Clayton. Thank you for such inspiring closing. So we are at the end of this event. And thank you to the Asian Global Institute for organizing this event, this discussion. And thank you for, we would like to thank the audience for being following and staying tuned for 1 hour. Thank you very much.